Doctor, my eyes have seen the years and the slow.
Welcome back to Accent Your Beauty with Dr. Mark Berkowitz, and I'm your co-host, Jackie Callan. Tonight's show is especially exciting for me because we're going to start off talking about injectables. And that's something that I've been a fan of and a customer of for over 30 years, and I recommend it to everyone. It's just like getting your hair done or your nails done. Get your face done, girls. It's all part of your beauty routine and maintaining your youthful good looks. Tonight I want to introduce our wonderful Silvia, who's here to show us not only how it's done, but all the different options that we have. There's so many different fillers. So let's start off by the history of fillers, because I guess it started out way back with people using their own fat, but that wasn't real popular, was it, Doc?
Well, the original fat, when it was used, they did not really prepare it correctly, and so we know a lot more about fat, and we're going to have a whole show just about fat.
Good.
But the fat that was used originally didn't last very long.
And then in the 80s,
went to collagen.
We got collagen, which was from a cow, right?
So collagen came from cows originally, and collagen does work well, but it doesn't last very long. And there were a lot of people that had allergic reactions to it as well.
Yeah, back in the day, we used to have to get this little thing like a TB test, you know, on your arm, and then you have to wait and see if you were allergic to it. Luckily, I wasn't, so that became my first go-to filler. And I've graduated since then. Tell us what they have now that lasts longer. And there's different fillers for different parts of the face, right?
Absolutely, yeah. Different fillers for different parts of the face. It all depends on how the product is kind of cross-linked made. But the majority of fillers are hyaluronic acid, which your body naturally produces. And so we use them to restore volume, to correct fine lines, again, depending on the exact filler, how it's made for different parts of the body, the face. And your body metabolizes it, just like it metabolizes the hyaluronic acid that you make. So depending on your own metabolism and the type of filler we're using, some last anywhere from a year to 2 years, all
That's
depending,
really
with
a lot of
hyaluronic
time.
acid. Yes.
Considering how at the beginning you would get a few months out of it.
Right, so
You'd have to go
now
back.
people know that they can get a year. And again, as Sylvia said, depending on where it's placed, if it's an area where there's not a lot of motion, so when I place into the tear trough area, it can last 2 years plus for people. Or as people come quite often for their nose or their chin, there's not a lot of motion to that area, and it can last more over 2 years.
Well, let's kind of start, if we can, from the top down. When someone comes to you and they want their forehead corrected, rather than fillers, you use Botox for the forehead area, correct?
Correct. Most upper face, forehead, around the eyes, and between the brows, which is the glabella. Those areas have a lot of movement, and what we're trying to do is kind of minimize that movement to not just prevent lines that can form in the future, but also to soften the lines that are there. So Botox is what's used for that part of the face.
And it actually kind of paralyzes the muscle. Is that what it does
Well,
temporarily, so that it doesn't move?
We like to think of it as it softens it just by weakening the muscle. We don't go for paralysis. We don't like the look that Joan Rivers had, where there's no facial expression.
Frozen face.
So the whole idea when we use Botox, Dysport, or Xeomin, those are the big three cousins like Coke, Pepsi, and Diet Coke, is that we just want to relax those muscles and soften that area. It's almost, I think of it as a hinge theory. When muscles are moving in an area, they wear out the fat within that area, and so we want to slow down that motion.
And that also can be used for people with headaches. We talked previously about that.
Correct.
That Botox has been used greatly for that.
Correct.
Now, what do you suggest for under the eyes? When you get into that area under the eyes where there's that hollow that forms on some people, so rather than bags, they get like that recess. What do you suggest for that area?
Filler, as Dr. Berkowitz mentioned, that's the tear trough area. So it's a very thin, delicate area, so you have to use the appropriate filler for that. So you can use that filler directly into the area, or depending on each person, that's why consultation is so important, but some people have lost volume in their cheeks and just need their cheeks lifted back up to conceal that area, so may not even need filler directly placed in there.
And that's important because people will come to us and say they want the tear trough filler, and if you just place it within the tear trough in some people, it can end up looking like they have a sausage within their under eye
that's
area.
not attractive.
And so you have to build up their cheek. The cheek is the foundation for the lower lid. And a lot of times what ends up happening is that tear trough forms because of the loss of volume in the cheek. The cheek pulls down on a ligament called the orbitomalar ligament, and that's what creates that tear trough. And so we need to lift the cheek to restore the volume. And as Silvia said, many people, you'll inject the cheek and you don't have to do anything else for their eyelid because the cheek is in the correct place.
It's all gravity, that old gravity that pulls everything from
true.
head to toe down.
It's true.
So now we know what we can do for the cheeks. Without getting cheek implants, you can actually get injections to try to lift up and give you that youthful kind of apple cherry round cheekbones, right?
That's right.
Absolutely, yes.
Yeah.
And then
So we can mold it. We can even, you bring up implants. So if a person wants to, we can even take out an implant, place it onto their cheek over their skin so they have an idea of what it would look like. And then we can, with filler, mold the implant into their cheek so they can get, without surgery, what a cheek implant
much
would look like.
safer and
Yeah.
much more cost efficient and less downtime. And then what about for the area on the sides, those nasolabial folds here?
Yes.
That's a different kind of filler?
That's a different kind of filler, but it also relates to the rest of the face. So when your cheek starts to drop, the fold is created. So you don't necessarily have to go in directly into the fold to correct it. You'd also want to kind of restore the cheek volume to help lift the fold. And then, if needed, you go into the fold and inject that. So most people will come in with the concern of the fold, thinking that's exactly what we're going to treat. But again, you have to kind of look at the whole face, look at the whole picture.
Yeah. I mean, the
correct
cheek
volume.
is key. It's the cheek that really affects where we're placing filler in other parts of the face.
So that's interesting. That's your focal point.
Yeah. So the deflation of the cheek can cause the nasolabial fold, can also cause that tear trough area as well to form. And so the cheek is really paramount in placing it correctly for someone.
And then if you overfill that area, then you get that kind of round face chipmunk
Very
look
unnatural.
that's not very pretty at all. And then of course we know that the lips, we're going to do a little demonstration with that in our next segment, but that's another area with a different kind of filler, correct? For the fine lines around the lips and the actual pouty lip part itself?
Yeah, absolutely. So for the fine lines, you want something that you can place more superficial. So it requires a filler that, again, just like the tear trough, it's very thin. It won't show through. It'll fill the lines nicely. And then for those who also want more volume or just to restore volume to the lip, you place filler in there as well.
And then also for those marionette lines
Correct.
that come from the corner of the lips down, that's a
Correct.
different kind of filler as well, or is that similar to the one you might use on other areas?
Exactly, similar to the one that you'd use in
So
other
sometimes
areas.
you can get one vial of a particular filler and use it in different places within one setting, right?
You can, but what most people don't realize is one volume, one syringe of filler is usually 1 cc. 1 cc is 1/5 of a teaspoon of volume. So when somebody says, "Oh, I just want one syringe to do my whole face," well, they're putting 1/5 of a teaspoon spread out. They're not going to see a difference. So that's why we have to take a look at the entire face, and we don't just chase lines. We look at the entire face, see what they need, and put together a plan for them. They don't have to pick the entire plan. They can pick parts of it, but they have to be educated and understand what we can do, what we can't do. As far as, the fillers are concerned, the fillers that we choose can be related. So you can have one filler that you're using in the cheek area that can be used also in the marionette area, and then its sister, depending, as Silvia said, on cross-linking, may be used for the nasolabial fold. So we look at all of those different things, where it's being placed, why it's being placed there, how long we want it to act when we choose a filler.
So do you sit down with the patient and draw up almost like a blueprint of their face and say, we're going to probably need this much in this area, this much of Juvederm, this much of Restylane, whatever it might be, and
Right.
this will probably cost you X number of dollars, this. so you can tell them how much the full face is.
Right.
And then if they don't have the funds to do it all at one time, I guess you can come back, do this area one time, save up a little, come back and do your eyes,
Right.
correct?
That's correct.
Right. And also,
I think
communication's important. You ask them, you talk to patients, you figure out what their biggest concerns are, and you kind of go from there too. So, yes, you give them the whole picture, but of course, if you have to break it down, you kind of prioritize.
Yeah, so we work with them. We find out from our clients, what they're trying to change, when they're trying to change it for. So is it a wedding that's coming up in a month, 6 months, or tomorrow?
Well, I would suggest going the day before.
You wouldn't believe the number of people who show up the day
You'd be
before.
surprised.
And that's surprisingly because you're possibly going to get bruised, and also it takes a few days for Botox to
Right.
take effect. So
Right.
you're not
Swelling
going to do it
involved
the day
and-
before.
It's
Yeah,
not,
absolutely.
not the best time.
And that's a good point. Most people do think you come in for Botox, it's immediate, and it's not immediate. It doesn't work immediately.
Well, as
so it
I was
takes a few
starting to
days.
say before, I think we have some video of you at work, and I think everybody at home would like to see what you do and how you do it. So let's go to one of our videos.
Okay.
So that's a video of you performing sculpture. So what do you like about sculpture? What does it do?
So sculpture is a non-invasive fat reduction procedure. It uses laser technology, which translates into heat. So if you watch closely in the video, there are 4 different sections to where we were working of the lower abdomen of the patient. Each section requires a plate. That plate sits on the skin for 25 minutes. It's a really quick procedure. And it starts to work. It starts to break down or actually damage fat cells, and then your body flushes out the fat cells naturally. It's a little different with each person, but typically it's a 3 to 4 month process for your body to completely flush out the fat cells. But the procedure reduces fat in that area that we're treating. 22% fat reduction in the area per treatment.
And it looked comfortable.
It's
So
a
didn't
comfortable
seem to be
procedure. Yes,
in
yes.
any kind of discomfort,
Yes.
which is good.
Yes.
Let's see what we have next.
So in that video, you were injecting Botox.
Correct.
So how do you decide where to place Botox?
One of the things is just talking to the patient again, seeing where their concerns are. Some people don't want certain areas to be treated, or just are concerned with crow's feet, which are around the eyes. But I like to also look at the patient's expression, see how much movement there is in an area, see the lines that are there, the lines that could potentially form just from seeing movement in the area.
And that's also not uncomfortable, mildly.
Just little mosquito bites.
Right,
Yeah.
because it's a small needle, isn't it?
It's a very tiny needle, yes.
Yeah, so it's very doable, very affordable, and
Couple minutes.
very worth it.
Yeah, very worth it.
I think we have some more of you.
Okay.
So that procedure is PRP, or platelet-rich plasma, and let's tell everybody what it does.
So as you can see, it was injected into the scalp, so that's for hair restoration, thinning hair for women and men, both. But basically we draw blood, we separate the blood with what's called a centrifuge, separates the blood. We take the portion of the blood that is clear, it's the plasma, and it's full of platelets, which help, it has growth factors in the hair, so it helps restore hair. Helps it thicken, grow, stop the shedding process.
Your job is so interesting. You must really love what you do. You meet some interesting people, and
Yes.
everybody's happy when they leave.
Yes.
When we come back, we're going to actually watch Silvia in action, because she's going to be injecting somebody's lips, and we're going to watch it. And I will say that she did freeze the person first with a numbing cream.
I did.
And also some ice. You put some ice on as
Correct.
well.
Icing.
So that helps so that you don't feel it as much.
And the icing helps constrict blood vessels, so less bruising, chances of bruising, I should say. So
Now, is this someone that you've done before, or is this a new patient?
it's a new patient.
It's a new
So
patient.
it's a first timer.
Wow, she's brave to do it on TV like this, on a podcast. But I think she's going to be really happy. I have a lot of friends who have done it, and they all really, really like it. And I'm thinking of doing a little just for my fine lines. So I have a feeling I'm going to be seeing you soon, too.
Perfect.
We'll get to this demonstration when we come back.
Hi, I'm Art, and we're the crew at Tuffy Walled Lake. We've been in Walled Lake for 20 years, and through our knowledgeable staff and customer satisfaction, we've become quite the cornerstone in our community. Please stop in and see why everybody comes from all over to get their cars serviced at 784 North Pontiac Trail in Walled Lake.
Guys, wait up. Hold on. Daddy said hold on.
You know, I was thinking, Bill,
Yeah.
I'm ready for our show, and you're ready for the show, but how do we let everyone know that we're ready for the show?
Slow motion rap video? Welcome to Creative Kaleidoscope. I'm your host, Russell Dunn, and on this show, we cover everything under the umbrella of art. Everything from painting to photography to movie making and much, much more.
Interviews, special guests, lots of fun, learn how to paint. It's a good time. Get your creative juices flowing on Creative Kaleidoscope, Sundays at 6 p.m. on newradiomedia.com.
And action.
And millions of ducks. Two guys go to newradiomedia.com.
The Arts and Entertainment Channel on New Radio Media .com.
We're back just in time to watch Silvia work her magic. And you'll see how simple it is to have those beautiful, lush, full lips. Go ahead, girl. Do your thing.
All right, so our patient here just wants just overall general increase in volume. We're using Versa today for her lip filler. Again, it's a hyaluronic acid filler. It lasts about a year to year and a half. We've already numbed her with topical numbing cream, cleansed it off, and we're going to go ahead and start.
And there are some people that we give a dental block to. So people who are a little bit more nervous, we can give a full dental block so they don't feel anything at all. And there are others who come in, I'd say half the people who don't ask for any numbing at all.
That's pretty brave.
So Silvia is right now going after Cupid's bow and the vermilion border. So where the red of the lip meets the white of the lip.
And that's an area that you want to have accentuated because that's the sexy, pouty, pretty look that girls go for.
So you want the difference. So with a beautiful lip, we look for most women for a ratio of 1 to 1.6. It's known as phi, and what it's found is that when you have that ratio of the upper lip of 1 and the lower lip to 1.6, and symmetry on both sides, that's when we see a beautiful lip. The other part that Silvia is looking at when she injects is that the upper lip is going to project a little bit more forward than the lower lip. So from side view, from profile, the upper lip should always sit a little bit more forward. And you can see there's just little pinpoints of bleeding, but nothing excessive in any way. And
she seems quite comfortable.
Yeah, and she's never had any injections before. She's never had Botox. She's never had any filler before.
She's a newbie.
And this is just a numbing cream around her, and she's able to, sit through it. And so it's something that's quite tolerable. And the main things, as you're getting injected, you take nice deep breaths in and out through your nose. People sometimes forget to breathe. And
they hold their breath just in anticipation.
And so just doing that and then smoothing it in place. And, what are people fearful of when it comes to lips? They're fearful that they're going to look like a duck, right?
Exactly.
And so that's injection technique being incorrect.
Or a blowfish. That's the other one.
Or
You don't want that blowfish look.
Yeah, I sometimes, and I know Silvia does too, we play bartender at times. People will come in and we say, you've had enough. You don't want to place anymore because that can give too much of a projection.
Take a break.
So, and Silvia's using one syringe, and the reason we pick both Versa and the other well-known fillers, Juvederm, for the lips is because in the lips you want the volume, and those fillers like water.
Let's do a break.
So because they like water, they give a more of a lush lip to the area. And so, placing that filler gives that little bit of lusciousness to the lip.
Well, she's a beautiful girl anyways, so she looked good before, and she's starting to look even more gorgeous.
So, when people look at the lip, they think it's just, one sausage-like, red thing. But it's not. There's actually an anatomy to it. So the lines called the philtrum that come in the area right over, for men, the mustache. And then the vermilion border we look at, which is the border between the red and the white. Then we also look at the wet-dry border. So there's a wet part of the lip and a dry part of the lip. And so it's important to know where those are when we're injecting as well. And then the central part of the lip, the tubercles, that we want to inject to give projection and fullness as well.
You want to go ahead and lay back?
So, how are you doing?
I'm okay.
All right.
How's the pain? How's the pain?
No, I don't feel it's just a little warm.
Okay.
I think it's the lights more than
It's
anything
the
else.
lights, really.
It's warm in here, believe me. But she's doing great.
Okay.
Yeah.
Okay.
So you want to finish?
Yeah, do the other half?
Yeah.
Okay.
So while she's finishing up, why don't we show some photos of before and afters?
Let's do that.
Some pictures of patients that both Silvia and I injected. Some of these patients, Silvia may have done the first syringe and I did the second. So
you kind of work as a team.
Yeah.
So it's pretty interesting because what ends up happening is that people love the look of that first syringe, and because they sometimes get swelling right afterwards, and then once the swelling goes down, they say they want more. So most people between 1 and 2 syringes. So we just saw her before, and now she has this beautiful lip afterwards.
How pretty that is. It's
And-
the perfect lip. It's like a doll.
Yeah. Let's go to our next pictures. So here we can see again a side view, and doesn't have much of a top lip. And then let's go to after. And you can see now she has the projection. She has some fullness to the lip too, but it's not overdone. It's just a beautiful
Well,
lip.
it looks natural.
Right, and that's the whole idea. We don't want people looking at you saying you had your lips done. It's just, wow, something's different about your smile, or maybe you had your teeth whitened.
Whatever.
Whatever it is, it's your secret. We hope that people tell their secret about us.
I think that's not the secret, but that's what you expect from any good cosmetic surgical procedure.
Correct.
Is that people don't know that you did it. They just know you look better.
Correct.
So again, here, I mean, she has nice lips, but they're a little bit deflated, especially the upper lip. And then afterwards, we increase her lip. And let's go to the next one. So when we go for, again, beauty, races, beauty can be different. So it's not always 1 to 1.6. And so sometimes it's 1 to 1 when we inject. And so we have to take a look and see culturally as well what's important in the lip.
Well, sure. Certain cultures naturally have larger lips.
Yes.
It's just the way, genetically they are. So do you do more in the top than the bottom on some people?
On some people we do, yeah. But a mistake is if somebody comes in and says, I only want in my upper lip, that's, I'll never do. I mean, unless there's something so different about them. Because if you just inject the upper lip, it may look okay from the front view, but the problem becomes the side view, where you get this projection from profile. But let's take a look at her after. And you can see how we
really
increased
pretty.
the size of her lips, and just a beautiful lip, and increasing both the upper and lower, but really concentrating on her upper lip that she needed more volume in. And again, upper and lower lips and increasing the volume.
That's a pretty big lower lip.
Yeah,
Yes.
I think that, by the way, is the way our picture ratio is showing. That,
Okay.
that lower lip is
Yeah.
not that big.
That's a little too big.
Yeah.
Yes.
I wouldn't want that.
There was very little put into
Yeah.
it.
Yeah, that's the picture ratio. And I think that's the last one.
Okay, so where are we here?
Oh, just waiting. We wanted to look through the before and afters. Doing okay?
Yes.
Okay. So I'm going to go out to the other side and kind of do the same thing here. Deep breath. Good.
And of course, the key to anything you've said before is symmetry, is that balance.
Balance and symmetry are beauty. When things are asymmetrical, our eyes are trained to catch that, and we know that something is off. But if you have pure symmetry, we see that as beauty. And so we're always trying to create as much symmetry as possible. And so I'm just going to stand so I can take a look at
Yes,
comments.
she's doing great.
So Sylvia's going into the red of the lip now, and so that will help with both the projection and the volume for her. But her lips looks beautiful.
Yeah,
and
it
you can
does.
see that vermilion line now has definition for her. And there's just a slight eversion of the lip, which gives a sexier lip as well. And going into the corner of the mouth is very important too. A lot of people have a downturn to their smile. And so by giving a little bit into the corner of the lip, you can give an upturn to the smile. So people will say, people think I'm unhappy all the time. And
so
and
true.
then you just give a little bit of filler right into the corner of the lips.
I'm so glad you mentioned that.
And that can
because
turn up the lip.
I have a friend that was asking me just that. How do I turn my frown into a smile? Is there any way you can do that?
see,
So
you can-
now we know there is.
So you can do it with filler. You can also do it with Botox. So there's a muscle in the area over
Smile?
here, and
Smile
that
13?
muscle pulls down
Perfect.
on the corners
Yeah,
of the
then
mouth.
I'll
So if
do
you
that.
inject in this area a little bit of Botox, you release that, and so it turns up the corner of the mouth.
So you can have a happier face.
So I mean,
So that's
I'm
it.
close up, but her lips look beautiful.
Yeah. So it's not even a full syringe. I'm going to have her look in the mirror, make sure this is where she doesn't want more, if she does want more.
Oh, it's so
I like
pretty.
to kind of stop
But
halfway
look how
through
beautiful.
and show.
Beautiful.
Yeah.
It's so pretty and natural looking. And she's smiling, so
Yeah.
it couldn't have been that bad.
Slowly turn toward me so the camera can see the side view as well, too. And it's just beautiful.
Very pretty. I
That's
know
been
people,
half so far.
people at home are watching this and saying, wow, it looks beautiful. She doesn't seem to be in any kind of discomfort. So what does that procedure cost? Because I'm sure everybody's saying, I want that. What
Yeah.
does it cost?
So we have a few different types of lip fillers that we like to use, so it can range anywhere between $500 and $750, just depending on the syringe or the type of filler we're using.
And don't let that scare you, because that lasts a year and a half. So you have to figure it out over a year and a half period. It's not that much per month. So that's the good news, that it's affordable. And look at you.
You look great, and this is the first time. I can't believe she comes on camera for her first injection.
That's pretty brave of her. But I think it lets everybody
Yeah, no.
at home see that it's not that bad. And people are afraid of the lip area being so sensitive. And here you can see that she's obviously... Tell us, how do you feel?
No.
Yeah, again, there's numbing within the filler itself at this point, so she's going to feel some numbness for probably the next 4 hours' time.
Yeah.
And when it wears off, she won't feel any discomfort.
No
because
discomfort. There should never be any pain after the numbing wears off.
I'd like her to get up and be able to see how she looks.
Yeah, I'll have her take a look and
we're
see if
gonna
we can
take
continue.
a break and see how she likes it, and then we'll be back to finish the job. We'll see you in 2 minutes.
It's all about you, and that's the way we like it.
Where you're going,
What you do to stay fit.
what you're eating.
What you're thinking?
And how you're feeling. Join the conversation at newradiomedia.com's Lifestyles channel.
Stream the life you want to live.
Want to stay informed, entertained, and enlightened? Get connected and stay connected today to New Radio Media. The New Radio Media app is now available for download in the Apple and Google Play Store. Just search for NRM Streams for unlimited access to archived, live, new, exciting, and unique content,
Welcome to Geektainment Weekly.
all for free. Do it now. Stay connected.
Maple Lane Golf Club is a 54-hole golfing treasure located in the heart of Sterling Heights. Maple Lane Golf Club offers immaculate greens, a top-flight pro shop, and inexpensive green fees. For convenience, book your tee time online at maplelanegolf.com. Come out and enjoy a great golf experience. Try our 9 and Dine special, 9 holes of golf, and enjoy food and refreshments in the Clubhouse Bistro. That's Maple Lane Golf Club in Sterling Heights. Check us out at maplelanegolf.com.
Hey, you guys, it's Raphael of the Teenage Mutant Ninja Turtles. Guess what? The only thing we can get down here in the sewer is Geektainment Weekly on New Radio Media. Turtle Power!
Well, it's time for the big reveal. I'm sure all of you want to see the results as much as I do, so let's take a look.
Oh my god, I love them. I love them.
Good. A little swollen, that's normal. Swelling, the majority of the swelling actually takes place tomorrow. So icing is going to help prevent as much swelling as possible, but it's going to happen. So expect about 72 hours of swelling. So not to do it a day before a big event, but a few days before should be okay.
Well, you look beautiful, and you sat right through that like it was just a day in the park.
Yeah, it
So
wasn't bad.
I'm sure that anybody at home looking can say, I would do that. I'm looking forward to seeing the products that we have tonight to look at. But before we look at the products, we're going to show a little video on how to analyze what your skin really needs and what's the best product line for you.
So this is the Image system. So this system, what will happen is we sit you down and there's light flashes, and during the light flashes pictures are taken of your skin, but not just ordinary pictures. They're pictures with special lights that are Polaroid lights, UV lights as well, and they show us what's underneath the skin, if you will, if we were to take off the top layers of the skin. So what's to come in the future. And so these are the pictures being taken, and now they'll go through for analysis. And so you can see here one of the pictures, again, with the polarized light showing the UV damage from the sun from years past. And so when we look at that, Silvia and the other staff will decide from there, depending upon the amount of damage, the amount of the pore size that you have, and other indicators, which products to use. And in this picture, we're looking at 4 different variations of the skin. And then what the computer does, which is a lot of fun, is it then determines your skin versus others, your age, race, and gender. So you compare yourself to your friends or your enemies. Or
Okay. You better hope that you stack up really good, otherwise it's depressing. But in case you don't stack up as good as you'd like to, we have products that will help you. So Silvia, what did you bring tonight, and tell us what it does?
Yeah, so the line that I brought here is by Arel. You know, nowadays, of course, people are really conscious about what they're putting in their bodies, the types of foods, where they come from, not just in their bodies, but also on their skin, what they use to wash their skin, their hair. So Arel is really nice because it's a medical grade natural line. So medical grade meaning it goes down deeper than what you would find with a line that's just over the counter. So it works really well in that way, but it's also very natural. So fragrance free. There's a few different, it's a whole product line. They have a cleanser, it's a really gentle exfoliator. They also have a serum. It's the age defying facial serum. They have a hydrating complex, which is basically a moisturizer, a very light moisturizer. They have a very thick moisturizer that you can place as a mask or just as an overnight type of therapy. And then they have something really nice here. We were talking about the fine lines underneath the eyes and around the lips. This is their eye and lip treatment. And so it's just a roller ball. It's nice to keep in the fridge because it's got a metal roller ball. You just roll it around the lip lines or underneath the eyes, and it's kind of fills the lines. It's obviously something you would do daily, and it's not permanent, but it's a really nice trick, maybe before
Especially
makeup
if you're
application.
Yes, right. If
exactly.
you're going someplace, blind date, we're on the internet, got to meet this guy tonight.
Right.
You don't have time
Right.
to do anything. You can roll that on, and it'll decrease a little bit of the
fine lines. It'll soften them, yeah. And all of their products have an ingredient called berry matrix, which is basically comes from blueberry extract, and it also helps. Obviously, it's an antioxidant, so it helps with aging and also just rejuvenation of the skin.
Yeah, so it helps to reverse sun damage. Not all the products need to be used every day. So again, that roller is something I tell people keep it in the refrigerator. I think when it's cold, it works even better. The mask is maybe once or twice a week, but it has healing manuka honey within it, and so it's quite nice as well. The exfoliating cleanser is my wife's favorite product, hands down. She loves that exfoliating cleanser, and she knows when I use it because it's out of place, and she yells at me. So I've got to get my own and bring it home.
Now, how does that compare to one that we saw in a previous show that also is an exfoliator?
So that one was from a product line called Revanesse, and that's used twice per week as a treatment mask. So they both are working to exfoliate, to turn over the skin, but the mask is, just with that Revanesse line. What's nice about this line is with the exfoliator, you can exfoliate every day. Now, men are lucky because we shave. We are exfoliating almost every day, but I think exfoliation, turning over those dead skin cells, gives a nice shine to the skin. You just have to be very careful if you're acne prone with exfoliation. So with exfoliation, if you're acne prone, you can cause breakouts. So I prefer somebody not using an exfoliant every day if they're acne prone.
Now, when you say use it every day, do you moisten the skin first so you don't put it on dry skin? Is that correct? You should
can put it on dry skin, actually.
Is it better on, because I've heard both that you should put it on.
It's such a
with
gentle
wet skin?
exfoliate, though, that it's not what you typically would think of as an exfoliator. It's not harsh at all. It's very fine. So it's not going to cause that kind of trauma to the skin if it's applied dry.
So it's mild enough that you can use this every day as just your regular cleanser.
In the shower, even, yeah.
Before you put on your other products.
Yes.
And in what order would you use them on a regular basis?
Any product, a serum always goes on first. A serum is absorbed the most on skin, and then it also helps other products on top of it absorb better. So you would put the serum on first, and then you would moisturize. And those are the two main products.
And there's only one product line where you don't do that, and that's the one that you use, the Definage.
I was just going to say that.
That's the only one that's completely...
the serum as the last step.
As the last step, yeah.
Right. Why is that?
Because with theirs, their barrier cream that you put on first, which is the moisturizer, actually kind of shuts things down. Doesn't allow anything else in except for the serum. The serum can get in. So then if you wanted to put a sunblock over it or your makeup over it, you can, but nothing else is going to get past that. Okay. And that's why on that product line is different than any other.
Now, do we want to talk price on these products? I think people would like to know, generally speaking, how much those products are.
So you can obviously purchase them individually. Each one a little different. The cleanser is about $60. The serum's about $150, I want to say. The moisturizers are around $80 to $90, and the treatment, the eye and lip treatment, I want to say is around $50. Or you can purchase the entire line together, and it's discounted that way.
Yeah, and so anybody who purchases the entire line would sell individually for over $500, but we bring it to $350 for the entire line.
That's a great deal. First of all, you'd want all the products. You wouldn't want to skip a step or buy one and not the other, because you're kind of shortchanging yourself on the overall effect. And $350 is very affordable for all those products. And I bet you that those last quite a long time. They look like they would last.
They absolutely do, yes.
How many months do you think you could get out of that kit?
I think it's a good 3-month supply.
Yeah, most products will last you around 3 months.
The mask might even last you longer just because you're not using it daily, not necessarily. You can use it 2-3 times a week, so that would probably even last longer.
And then you brought a couple of other products, I see,
yes,
that are more for the hair. Is that correct?
Yes.
Tell me what those are.
These are hair vitamins, and again, they are a natural product, so there's no chemicals in them. Every ingredient in there is herbal or just natural. So, and there's 2 different variations. There's one for men, one for women. Similar ingredients, but a little different depending on the sex of for the product, but does not contain gluten, wheat, shellfish, or binders. I do like telling people that just because those are all ingredients that people stay away from after educating themselves and reading and knowing just to be a little bit more educated with ingredients that you place in your body or on your skin.
And the reason why different for men and for women, as we spoke in the past with hair, for men, the hormone testosterone then turns to DHT, and this blocks DHT. It's DHT that causes the miniaturization of hair, and so we want to make sure we block it, and this naturally blocks it compared to some of the other products that can be used as well. This is the only one that's natural, and I think most of my staff has been using it.
I've been using it for months. So its best results are seen at 3 months and past. So you should really just be using it for at least 3 months to see results. But I know from my personal experience and from patients that a month into the product and you'll notice some thickness to the hair.
Really? Now, it's interesting that you mentioned that you use it as well, because I think people need to understand that not every product is going to be magic. You're not going to see the results overnight.
Right.
And I think that you have to invest some time and patience to get the results that you want. And I think it's important to explain that to the patient.
And we can see some results of the product. I believe we have some before and after pictures. And these pictures are just of people who just use this product alone. Oh, this is for a later segment.
Yeah, we're gonna hold that for a later segment and go back to the products that we have right here.
Right. So the before and afters that we're going to show, they are of patients who've been using it for at least 3 months. I think I want to say 4 and 5 months. One's men, one's women. But that's more for growth, you see. But thickness of the hair, texture, you notice that earlier on.
Now, how do you know if you're a candidate for either of those products? I mean, certainly men know when they're starting to lose their hair, and this is like a stopgap before you would go into a more intensive treatment, like surgery.
I think, unfortunately, most people may not realize that they're losing hair until they lose close to 50% of their hair. And so they can have a tremendous change before it's even noticed because of their, let's say, 100,000, 50,000 has given them enough coverage. And when they come in and they're first noticing it, they're noticing in the drain, quite a bit of hair. If they start this product, it will help them to make a change. But there are people who will know their body a bit better and will notice things even sooner than that. And this is a great way to start as far as minimizing hair loss.
Now, do you recommend that you do that every single day? Is it an alternative to shampoo or is it in addition to shampoo?
No, it's an addition, and it is a daily, it's actually 4 capsules once a day, which is nice because a lot of products like this, you have to split it up between the day and people forget day or night and you just don't end up with the results that you're looking for. But this is once a day, 4 capsules, and it's something you would use in addition to any other type of therapy.
So it's basically like a vitamin for your hair.
It is.
And it's nice because a lot of the ingredients in there can also affect the body in other ways. So even mood. So actually there's ingredients in there that will help improve mood. There's an ingredient, saw palmetto, in there that also helps keep your blood pressure a bit more stable, obviously, if you lead a healthy lifestyle in addition.
I found out about the product from another physician who I trust, and she was having problems with arthritis. And she noticed that her arthritis got better as well using this product.
Did we discuss price on these miracle drugs? Because I want to know.
It's $88 per bottle.
Oh,
that's a 1-month supply.
Yeah.
And I do want to add that there's a big difference between the products that you get from your doctor's office and the products that you get at Nordstrom's or Saks. They're a much better quality, and in often cases, they're less money than what you pay at Nordstrom's, and they're much, much better. So before you go to a department store and spend $500, go see Dr. Berkowitz, spend $350, and you will be gorgeous. We'll be back.
At Murray's Part City, we're known for offering customer service you won't get in any chain store or online. But don't take it from me, just listen to what our customers have to say.
The employees at Murray's are knowledgeable, courteous.
They make you feel like you're at home.
Pick up a can of Seafoam Fuel System treatment for only $6.99 or a 5-quart container of Mobil 1 motor oil for just $28.95. Murray's Part City and Pontiac Trail at Maple Road in Walled Lake.
We've got the parts you need when you need them.
Why are we here? What makes a person truly good? For those answers, you're going to have to take a philosophy class. But if you're more interested in who would win in a fight between R2-D2 and a Dalek, watch Get It to the Geeks on Tuesdays at 6 p.m. on newradiomedia.com.
What's going on in your neighborhood?
They say it takes a village.
It's the simple things.
The things that are a testament to the old.
And the things that are a testament to the new.
Know what's going on in your community.
Check out our community channel on newradiomedia.com.
Advertising your business these days can be challenging. Traditional radio and TV ads are expensive and, frankly, a bit of a crapshoot. Not to mention, the audience for over-the-air material is shrinking as more and more of us demand to see and hear what we want when we want. Advertising on new radio media is a solution. With our live streaming programs that are also available on demand, your message is always ready when your customers are ready to watch and listen, all for a fraction of what you'd likely have been paying for other ads. NewRadioMedia.com. Call Buzz Van Houten at 248-939-9999 for more information.
Okay, here comes the fun segment of the show. We're going to look at some people that we all know, celebrities that we all look up to, and our guest Callie is going to help us decide whether they've had work done, and if so, what they've had done. Of course, it's just our opinion, but she's an expert, the doctor's an expert, so let's look at our first picture.
So this is one of the pictures I found. This is Angelina Jolie. So can you guys spot what plastic surgery you think she's gotten done?
So we just spoke about lips, and so she's known for her lips, but if the upper lip is more than likely been enhanced for her. And as I said earlier, if you're going to enhance the upper lip, more than likely you're going to do the lower lip too. Her nose has definitely been thinned as well.
Definitely the nose. I was going to say that right away. She's been known for those lips since she was a little girl. I've seen pictures of her as a child, and she was born with beautiful lips, but it definitely looks like her lower lip was always larger, and she filled the top one so there'd be more, like you said, more symmetry.
You know, because she's younger in one picture than the other, it's hard to say 100%, but it looks like she does have some fill within her cheek. And looks good, and right below the cheek where the buccal fat is, I don't think for her it was removed. I think it was just that the cheek was built up for her.
She's beautiful in both pictures, though.
Oh, yeah.
So whatever she did, she's stunning.
It doesn't look like she's aged at all. Maybe her cheeks, or I don't know.
Well, like Dr. Berkowitz said, the cheeks are the focal point of your whole face. So she knew what she was doing.
Yeah, very true.
And who do we have next?
Yes, so this is Ariana Grande, and as you can tell, she looks different as she's grown up a little bit. You can tell her nose has been brought in. Her cheeks may have gotten something as well. What do you think, Dr. B?
So, yeah, her nose has been thinned out. Her eyes, I'm really hoping nobody did this to her, but if you look at her upper eyelids, it looks as if she's lost some of the fatty tissue that's there. You usually don't see that in somebody until they're 80 years old. And so it looks as if she may have had some eyelid surgery. Now, because if you also look at the space between her eye, where you see the flash go off, and her brow, the brow is a bit raised as well. And so that could have been Botox for her that raised the brow, but I'm not happy looking at her upper eyelids.
Do you think that someone as young as this beautiful girl needs plastic surgery, other than the nose, which a lot of people like a thinner nose? But why would you mess with beauty like that at such a young age?
I think especially with my generation, social media is so huge now that it's so easy to go on Instagram and start scrolling and then start comparing, and you see these supermodels or Victoria's Secret models, and you just start to compare to them, and you're like, oh. Well.
But a lot of them are airbrushed, and we all have the photoshopping apps, and you can see, you can thin your nose, you can lift your cheeks. All of that's just on a free app you can get on your iPhone.
But people want to look like the Snapchat filter.
Yeah. They think it's real.
Mm-hmm.
They forget that it's photoshopped, and it's so easy to get caught up in it, and just
it does,
it's a ripple
and it
effect.
sends a bad message to the young girls thinking that they have to look like these models. Who else do we have that we can tear apart?
Oh, Blake Lively. So gorgeous. She's an icon. Yes, can you notice?
So she's definitely had fill in her lip, because you look how flat her upper lip is. But I think it looks good. I think, just that small amount looks good. Again, her cheeks, you can see that there is additional volume in her cheeks as well.
And her nose is thinner.
Her nose is thinner. And I think this is a Botox brow lift. I don't think she had surgery on her brows. I just think that by the shape of the brow that this is Botox lifting for her.
Well,
she looks great.
Beautiful.
Yeah, looks
she's
great.
a beautiful girl.
Yeah, and she was confident to admit that she had gotten a nose job too. Some of the celebrities keep it a secret.
Well,
but-
you know, it doesn't make sense to lie about something that's so obvious when you can look at a person and say that nose is a lot thinner and more defined than it was before. Do these people think we're going to believe that they just woke up in the morning and their nose just changed? So it's good to be honest so that people understand that they did get a nose job, but it looks very good on her.
Yeah, I agree.
Let's see who we have next.
So I thought it'd be good to incorporate a male into this segment because you don't really hear a lot about that. You don't hear a lot about males getting plastic surgery. So
I can't see that he's done much. I mean, to my eye, what do you think, Dr. Berkowitz?
So, you know, in looking besides the hair dye,
Well, and maybe the hairline.
the hairline, but the hairline, that can be just some filler that's placed in, basically just powder that's placed to change that hairline for him. I'd have to look closer to see if it was a transplant, but it's possible. But, you know, in the picture here, we're not seeing any wrinkles at all with the smile. We're seeing wrinkles on his crow's feet in the other picture. You know, I'm assuming that the black tie is the later in life picture for him.
Yes.
Yeah. So he obviously didn't have Botox in there, and if he did, it's not the best Botox job for him.
Well, he's a handsome man,
Yeah.
and I think he looks good in both pictures. The noticeable thing, of course, is the hairline, which is a little straighter on the right and not as much of the balding over here that you see in the first picture. Not that he's bald and he's still drop dead gorgeous, but you can see that he has done something. But as you say, Callie, you're the expert in this, most people in Hollywood who are in the limelight do something. They want to make themselves look as beautiful as they can.
They do, and it's something that there are procedures that get them ready for the award shows, and there are procedures that get them ready for movies, and procedures just get them ready for life.
That's it for tonight. Stay beautiful. We'll be back next week.